Hey, Adam,
Geez,
one
why,
thing.
why do you think they call it bumpers, Gary?
I don't know.
Because they come at the beginning, at the end, like bumpers.
Alex, you're a marketing guy. Do you like that design behind Paul? Does that sweet logo thing look pretty cool to you?
Hey, I forgot to hit the record button.
Yeah, that's really professional, isn't it?
Well, this is a professional podcast.
I met her in a parking lot and was handed 2 little Yorkies. And the only person I knew that knew Yorkies was Paul. So I called Paul and said, Paul.
Sweet Talk is a weekly 20-minute podcast brought to you by the Continuing Education and Workforce Training Division of Idaho State University's College of Technology. Find us on Apple Podcast, Spotify, and SoundCloud, and subscribe today. Now it's time to get started with Sweet Talk.
Hello, everyone. Welcome back to Sweet Talk, our weekly podcast here at Idaho State University's Continuing Education and Workforce Training. I am Paul Dickey. I'm the apprenticeship coordinator here at Sweet. And as always, joining me is Angie Wilhelm, our marketing director. Good morning, Angie.
Good morning, Paul. Hello to everybody that watches us continuously and anyone new. Today is Friday the 13th, so that's a fun fact for you. We will be posting this later, but as of recording, it's Friday the 13th. We are also joined by Raylan Price, the director of ISU's Continuing Education and Workforce Development. How are you, Raylan?
I'm doing great. Thanks, Angie. I'm pretty excited to be here today. Emergency Medicine Conference has kind of been my baby for a lot of years, and I turned my baby over to Paige this year. And she's doing a fantastic job with it. So excited to be here, excited for our guest that we get to hear, and actually the keynote for our conference. So excited to have him on here. So with that, I'm just going to turn this right over to Paige.
Thanks, Raylan. So I'm Paige Ellis. I'm the Health Programs Coordinator at Continuing Education Workforce Training. And Dave, I would love to hear more about your SAR experience, working on Denali, being our keynote here at the upcoming conference. So I'm going to turn it right over to you because I'm really excited to hear some more about what you're going to talk to us about at the conference this year.
Well, great. First of all, thanks for having me here, and even more so for having me at the conference. I've heard of this conference through friends for probably 5 years and heard great things about it, Raylan. So you've set the bar. It was an honor to be invited to speak in any capacity, much less get to do 4 talks over the course of 2 days.
Wow.
My background, I typically split my year doing 3 different things. One of the jobs I have throughout the year is working as a flight paramedic and hoist rescuer down in the state of Utah for Intermountain Health. So that's how I maintain I would say my critical care skill set every year. The second thing I spend part of my year doing is working as a National Park Service climbing ranger. I've done that now at 4 different national parks. I started in Zion, then I went to Mount Rainier for a handful of seasons. And I was at Denali doing that rescue work for 14 years. And then I was lucky enough to get a spot on the Grand Teton rescue team 5 years ago. And so that's where I spend my summers now. And then lastly, I own a training and consulting business called Mountain Rescue Collective. And our primary mission is to provide both realistic but practical combined technical skill training to different people. I think for myself, I found that as a student, I became a bit frustrated that we tend to partition out all of our training. And so you spend time training, say, single skill set. Like now we're going to talk about avalanche. Now we'll do swiftwater. Now we'll do helicopters. And in reality, no rescue ever goes down with a single skill set. And so everything we do is a combination of different skill sets. And that's something that we really, 1, enjoy teaching, and 2, think that a lot of teams need to have those things combined. Because I'm sure all of you know from your work experience that there's not a single skill set that gets you through any problem that you all are trying to tackle. You've got to combine the leadership components of it and the technical skills with it and probably a variety of other things. So But at baseline, I'm thrilled to be here today and looking even more forward to the end of February and being at the conference in person.
Excellent, excellent. So, what started off your career?
Oh, yeah, this is probably when I disappointed my parents the most when I went to college and they're like, wait, you're going to college and now you're going to be a park ranger, something that you didn't need to go to college for. I went with the intent and the idea that I was going to go to med school and very quickly learned that although medical school and practicing in the clinical or a hospital setting was likely just not for me. I really liked working outside and figuring out a way to combine those two interests. Took a little while, but I did get an internship in Zion National Park, and that was the light bulb moment for me. So after graduating college, taking that internship and seeing a place where the technical skills and the climbing that I like to do and being outdoors, plus the medicine and the search and rescue all combined in a single job description, I knew that was it for me.
Wow.
When I found and saw that team operate, I was like, okay, there's something here for me. Where prior it had been, I'm sure you can imagine with folks at Idaho State that there's more traditional pathways and being one that is quite out of the box in the traditional education framework. It took me a little while to get there, but I'm glad that I did.
So
No,
after
you
your internship in Zion's, is that when you decided to become a paramedic, or was that later?
No, that's also a long and convoluted story. I had my paramedic at that point. I
Okay.
got my paramedic when I was in college.
Okay,
I was
cool.
part of a program that was a part of the curriculum, and then I came out into the workforce. And at that time, the National Park Service didn't really recognize the paramedic level cert. They had essentially a cert that was one level down from that. Advanced EMT is what most people know it by. So then I dropped my paramedic to be an advanced EMT. And then later, of course, 5 years later or so, then the Park Service decided, wait a sec, we are going to recognize paramedics. So then I got to go back to paramedic school a second time. That's my biggest goal in life, is to keep people from taking all of these unnecessary side routes that I took. There is a more streamlined path for everyone out there.
Sometimes you have to just find that path, right? The
Yeah.
experience of that path is what makes you who you are.
Yeah, it is. Yeah, they say it's the journey and not the destination. I didn't need so many destinations, maybe.
Right.
I love
So
that.
I have a question for you, Dave. Was there ever a call you were on or a moment in your career that really made you think, yes, this is what I'm supposed to do?
Honestly, it might sound cliche, but probably every single one. I know the first one, and I can tell you that story, but even to this day, every time we get to go out and help someone, and I think the difference maybe between normal pre-hospital medicine or in-hospital medicine is that we're going to be first person on scene and getting to these people that are in very remote circumstances and getting to help them out on what is likely one of their worst days is always reassurance that at least I am doing the right thing with my life. It takes a huge team and a broad skill set for us to pull off these rescues, and I'm really grateful for that. The first one was in Zion, and I remember if you've ever been there, there's the Virgin River, and the Narrows is a really popular hike for a lot of people. This beautiful, I think it's 13, maybe 16 miles long, this one-way trip down a riverbed, which for most people, they are not used to walking in water and walking down a riverbed. And people turn their ankles and hurt lower legs all the time in there, as you can imagine, walking on slippery rocks for 15 miles or so. So we got called in and we approached from the bottom. And so going against the current with a floating litter, and we were probably 16 people at that point in time. I just remember I have so many snapshots of that rescue in my head. Whereas we're going down, this lady had hurt her lower leg, but also had hit her head when she had fallen. And so it was a decently complex patient, but doing that with a team in this environment and then getting to float her down on this raft over the course of the next couple hours, I do distinctly remember I was like, this is it. Like I have so many, it was well before the time of iPhones and easy access cameras, and I have so many snapshots of that rescue in my head that still to this day, that was in 2001. And so what, 25 years later, I can still replay a ton of those details. But that was the original, I think, rescue that probably solidified that this is for me.
Wow.
Very nice.
Did I hear right? Said you were on a flight rescue as well?
Yep, I am really lucky in that the National Park Service is a seasonal employment for myself, and that usually runs in the Tetons from May until September or so. But throughout the year, I'm employed as a flight paramedic and a hoist rescuer. That program in Utah also has a helicopter rescue component to it. And so I am really grateful that especially Intermountain Health tolerates my schedule and allows me to leave for periods of time and come back and maintain employment. I do joke sometimes that people ask, like, how can I do that? I was like, they will never let it happen again. I got in, I ruined it for everyone. It will never occur for anyone else, and I'm sorry. But they're really, really accommodating because I think they do see that there's some benefit to people working in other environments and continuing to have expertise in other areas. And they've been great at supporting me to go to the Tetons for periods of time and then come back and work for them and see where that does benefit our teams and our patients.
That's great. So with your work as the flight paramedic, how does that differ from what you're doing in the Tetons, and like what kind of rescues and that type of thing do you see the difference with?
That's a great question, Raylyn. It's quite different. I would say I get very little practice with my medical skills in the Tetons and in the national park. The reason for that being our primary mission is more extraction, getting them out of the mountains. And so sure, there's the initial assessment and maybe some basic life-threatening treatments for folks, but our main job is extraction to definitive care. And for us, that means either flying them in a helicopter or carrying them out in, say, a wheeled litter to get them to an ambulance that can then take them to the hospital. And so a majority of that care is rather basic and streamlined so that we can focus on the movement element of that. When I transitioned to the role at Intermountain Health and as a flight medic, that is essentially a paramedic and nurse operating at the top of their certification. So we get to do things that most non-critical care, non-flight paramedics would never get to do. And so it's a really great, I think, dichotomy between those two worlds for me is to go from this really basic care model to almost being able to do anything and everything a paramedic could ever do.
Wow.
With Intermountain Health. But then I think the beauty in all of it is to come back and see where those things overlap, because I'm sure you all have experienced that when you do have the ability to do things that are more advanced or have a more advanced skill set, sometimes we're drawn to do those things, whether they're warranted or not. And so there are many times in the critical care world where I've been able to pull from the kind of extrication and evacuation model of the Park Service and say, hey, wait a sec, this isn't critical right now. Perhaps we should keep moving, and perhaps we should not be doing this advanced care right now. And it's more important to say, get them to the hospital. And so I think I get to lean on both skill sets in both jobs. But yeah, as you asked, Raylan, they are quite different in skills, capability, and expectations of what we're supposed to do.
What has been maybe your most difficult case, if you can say that, with your medic in the medic world?
Oh, yeah, that's a great one. You know, I think when you say difficult, I think the initial cases that come to mind are not the challenging medical or challenging rescue cases. The unique component of both the rescue team at Intermountain and also the Park Service is there are almost always friends and family around. Like when people are out in the national parks, they're recreating with family and they're recreating with friends. And so I think to rescues that were difficult were the ones where family are there witnessing this, and it might have had a bad outcome or a fatal outcome for the injured person or the ill person. And so those are probably the ones that are the most difficult, because we don't, so much of our training is focused on, well, you just deal with the patient. That's all your focus is. That's where your energy and your team is kind of driving it, making things better. And in reality, in a lot of these scenarios, you've got a whole nother group of people that might require equal or more treatment, especially if it's a really bad incident for the climber. And so when I think about the difficult ones, it's the time when I have to sit there and kind of console a friend or family member through what's going on, rather than the taking care of a patient. Those are the ones that are tricky, because I think above all, we talk about the patient should come first. And I think for that to happen, we really need to remember the human component of a lot of these. And often I think our training sometimes sets us up to kind of check these boxes off, especially in pre-hospital medicine. It's like, get this done and this done and this done. And at some point, you've got to get to the end of that algorithm and realize when it's time to just take a deep breath and be a fellow human with either the patient or with their friends and family that are there to say, hey, I'm really sorry about this. We are doing everything we can to help this situation. Or hey, I'm really sorry it turned out this way. What can we do for you now that is not medical support at all? And so I think coming back and circling back to the human element are the ones where I think those ones are difficult to turn all of our kind of type A brains that are really focused on kind of execution and getting the job done. And there's a time when the job is to take care of either your team or yourself or the patient or their friends and family. And those are the ones that, for me, I think are probably the most difficult, is getting my type A brain to stop.
Yeah, I can see that. Well, thank you. Thank you for sharing that. Yeah.
So, I don't know if all our listeners know what the Emergency Medical Conference is. So maybe Paige, just take a moment to maybe explain what the Emergency Medical Conference is, and then Dave can say what he's bringing to the table.
So the Emergency Medicine Conference is I believe we're going on our 8th year now for providing education around emergency medical services. So first responders, firefighters, paramedics, nurses, doctors, students, anybody who is providing that emergency medical care. So Idaho is majority rural. So we really try to look at that care that and the education that those folks are going to need. There's a wilderness track, and this year we're focusing on obstetrics. So there is sessions throughout the conference that are going to have that. But also Dave, we brought Dave in to focus on that wilderness track for our search and rescue folks, for our ski patrol. And again, Idaho's majority rural. So we really try to look at what those pre-hospital care providers are needing. So with that, Dave, what do you think as far as what you're bringing to the table in that lane?
I'm so grateful for the invitation, and I think the topics that we've picked out to present, I'm really pleased with, because I do think it's a good overview of various things in wilderness medicine. We start with a talk on team dynamics, and if I was to give one talk for the rest of my life, it would probably be that, because I think team dynamics are the factor that underlies all successful or all unsuccessful teams and responses. And without team dynamics, everything we're doing by ourselves to increase our, say, capabilities as an EMT or get better as a ski patroller, none of that really matters if we can't do it well as a team. And so that's where we start. After that, we've got a talk on a very unfortunate incident that occurred back in 2012. A dear friend of mine died during a rescue on Mount Rainier. And so for me to take that awful incident and find some kind of hope and a path forward within that circumstance, we'll talk about in the middle of that first day. It's it's a talk that's really near and dear to me about a good friend, Nick Hall, and kind of the lessons learned from that I think are applicable to anyone responding, no matter what your work environment is, whether it is ski patrol or if it's Forest Service or Park Service or if it's traditional ground-based EMS or flight. Lessons there. On the second day, we'll spend some time talking about mountain medicine on Denali specifically. As I mentioned, I was there for 14 seasons, and at the end of my time there, I was the medical program director there to help kind of outline what it was that we did for care on the mountain. It's a very unique environment in the world, and much less in the U.S. And so we look at the things that actually happen out there, because I think oftentimes people will drive their care and their studies at the one-offs, maybe the things that don't actually happen that often. And so we want to put some context into, hey, here's what we actually see out of a 20-year period. Here's what we actually saw on the mountain. And so also what you should be prepared for as a recreationalist in those environments or as a care provider in those. And then lastly, I think the closeout talk is going to talk about the benefits of failure. I think there's huge benefits to failing. We've all failed. We will all continue to fail, and that's where I think we see the most growth. And so that talk at the end, but also all the rest are centered around a case study of some sort. And this one involves a significant failure on my part, and then all the lessons learned after that. But in the end, I think allowing folks to leave the conference inspired and also with a realistic expectation that failure is going to happen. Failure is good, and failure is really how we all get better as individuals and teams.
Nice.
Yeah.
Nice.
What I really appreciate about what Dave is bringing to the table is that mix of traditional, because most of our folks are, traditional paramedics, EMTs, nurses, but also that austere environment, that wilderness piece, that because we live in Idaho, that's just part, whether we're recreating or whether we're working in a capacity in a healthcare profession, it's just a reality. We have lots of open area and lots of things we're going to see. So I appreciate that.
Yeah, I do think you are in a unique state, similar to Alaska and Montana, where I am now, that every call has the potential to be an austere wilderness medicine call. As part of my flight job, flying to Boise in a fixed wing and then taking an ambulance in the middle of a snowstorm, those folks, that could have so easily gone off the rails, been off the side of the road, and then we're inside a metal box in a wilderness scenario. And so I think every care provider in Idaho, every time they leave the station or their base, is got a chance that that's going to turn into an austere medicine environment at some point.
Excellent. Excellent. Well, Dave, thank you so much for joining us this morning. I really appreciate it. Looking forward. I will be there at the conference, so I'm looking forward to meeting you. Hey, Angie, could you tell people when the conference is and where they might find the registration for that?
Yes, our conference actually is at the end of next week. This will be up there a little bit before that, maybe a week before. It's February 26th through the 28th. The 26th is for our pre-conferences, and then the 27th and the 28th are the regular conference schedule. The schedules as well as registration can be found at cetrain.isu.edu/EMC, or you can just go ahead and call our office if you're interested in that. That phone number is 208-282-3372.
Thank you so much, Angie. Dave, again, thank you so much for joining us today. Really appreciate it. Raylan, thank you so much for being here. Really, again, always used to do fun doing this with you. Paige, thank you. Paige, I'm looking forward to you being on more of these things.
Maybe not so early. I need more coffee on board.
And Angie, I cannot do this without you. So greatly appreciate everything that you do. And thank you everyone for joining us, and be safe out there.